Next on the list are the NDRIs, and that is a very nice name because it stands for norepinephrine dopamine reuptake inhibitors. And again, this tells you already what this drug class do. They block the reuptake of norepinephrine and dopamine. So this is now the first drug class where we're going to affect dopamine. That's this DAT, the dopamine transporter, taking back up dopamine. So with these drugs, we're going to increase dopamine and norepinephrine. And now, very importantly, that's our only drug class within the antidepressants that is not going to affect serotonin, which is very special. And there's only one representative for this drug class, a very famous drug. It's called Bupropion. So definitively a drug that everyone should know about, Bupropion. And it affects dopamine and norepinephrine, no serotonin. This has a big advantage because now we got finally rid of all the serotonergic adverse effects. And the one that is certainly very bothersome is sexual dysfunction. So bupropion is a solution if the sexual dysfunction adverse effect is bothersome, because here you're not going to touch serotonin. We're going to stick to norepinephrine, and then we're also going to increase dopamine. And this is the only drug where we selectively inhibit this dopamine transport and increase dopamine, where it said that can lead to psychosis and the risk of seizures. That's actually also a black box warning. So you cannot, BBW for black box warning, you cannot prescribe anyone with an underlying seizure disorder this drug because it increases the risk of seizures. Then the other thing is it does a usual thing, increases heart rate, makes you more agitated, but again, it does not necessarily lead to an increased blood pressure. And why is that? Because dopamine also has vasodilatory properties, so they kind of cancel each other out. So I removed again the increase in blood pressure. So it really comes only up for the SNRIs, because that's kind of where it's unopposed. And for all the other drug classes, you have then something where another effect lowers the blood pressure and then it somehow cancels each other out. Now for bupropion, we should know a couple of more special things. I'm going to stick to black box warning and adverse effect first. You cannot only not give it in patients that have an underlying seizure disorder, you can also not give it to patients with underlying, so contraindicated indication, eating disorder, patient with eating disorder, and let's put here also and patient with seizure disorder, because that fits with our increased risk of seizures. And why is that? This drug actually leads to weight loss, and it's so good in doing that that it even got approved as a weight loss drug in a combination with another drug. So bupropion leads to weight loss as another adverse effect. Weight loss. So we have our dopaminergic adverse effects, our noradrenergic adverse effects, and then we have our weight loss, and then our important contraindications. And then another thing that you should know about bupropion is it has also a famous other indication. It is used for smoking cessation, as in addition to major depression. So another indication is smoking cessation. And that's also something important, comes up a lot of times, has probably to do with the dopamine, because we know addiction has to do with increased dopamine levels in the nucleus accumbens, and probably it's helping patients to quit smoking when they're on this drug, because then you at least get this dopamine back in the center that are important for addiction. So that's another important indication. So if you have a patient with major depression and wants to quit smoking, that's definitely a good drug to think about.